You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, a new type of liposuction that allows for a faster recovery, shorter downtime than traditional liposuction, and better results, according to my first guest. In fact, his patients drive home after the procedure. It's that good. With us, we have board-certified plastic surgeon, Dr. Jeffrey Didesheim. Dr. Didesheim, welcome to the program.
Thank you.
All right, now how long have you been, by the way, in North Carolina?
I've been in North Carolina for about 20 years.
20 years. So for people that don't know your practice, now we've invited you on the program to talk about this new Aquashape liposuction, right, that you love, but you do more than that. You do all types of procedures. So who is your typical patient, and what are the different procedures and services you offer?
Right, so my practice is specialized in cosmetic or aesthetic plastic surgery. That means we're doing elective surgery for men, women, different ages. It could be someone in their 20s, 30s, 40s, 50s, 60s, sometimes 70s. For people who want an improvement, who want more confidence.
Okay, good. Now, liposuction. How many years have you been doing liposuction?
So if you include the time I've trained and the time I've been in practice, it's 30 years. But I've actually been in practice for 20 years doing liposuction.
So is liposuction still the most popular cosmetic procedure?
It is the most popular cosmetic procedure. And the funny thing is that it's not for everybody, but it's for everybody. Because who doesn't have a little bit of fat somewhere that they wish they didn't have? Maybe, you know, it's like for me, like I'd love to have a little bit of liposuction on my tummy. I might have a six-pack. Would it make me find a new wife? No, but would I feel like I was, you know, more buff on the beach? Yeah, maybe. So if it would work for me, it would work for anybody. Now,
but it's more predictable than ever, you say.
But here's the difference with the Aquashape, okay? So, and this was just, you know, I was lucky. I trained at all the best places, and I've been doing this for 20 years, and I'm looking for something better. And, you know, some of my colleagues said, why don't you just do what everyone else does? I've tried all the other techniques. They're okay. They do remove fat. But if I'm the patient, I just don't want the fat removed. What I want is I want to get in, get the fat removed, get the result right away, and I want to get back to my life. When guys come to me and they say, okay, I have man boobs. I've got too much fullness here. I'm embarrassed. But if you're going to do this for me, I got to be back tomorrow at the office. So I'm thinking, okay, can that be done? So I worked with this and studied this procedure.
It's called
Aquashape.
Aquashape liposuction.
Right. So think about this. You think, okay, you have fatty tissue, stubborn fatty tissue you don't like. Right. You want it gone. Do you want to be bruised and swollen and wrapped up in a bandage and leaking and all those things in the recovery and be laid up for 3 to 6 weeks? No, you don't want that. And if that's what you think you're going to have, you're just not going to do it. You say, okay, it's okay. I don't want to go through the pain and the frustration. So why can't there be a procedure that gets rid of the fat but doesn't do so much trauma to the body?
Okay.
And
this does it.
And this does it. Now, how do I know that? Because 4.5 years ago, I found out about this. I was looking for something better. Not something to take away fat. There's all kinds of things that take away fat. Cool sculpting takes away fat. Power lipo, laser lipo. There's lots of ways to take away fat. That's not what scares us. It's not what scares my patients. What scares them is the recovery. So why can't you get rid of the extra fat, the unwanted fat, the stubborn fat, and have a good recovery? So with Aquashape, what is different is that the recovery is not what it was before.
Why?
Because Aquashape, let me tell you how it works. Aquashape works by using a water jet to wash away the fat. It's really that simple. I can control how strong that jet is.
But you still have to go in with some sort of a cannula to take the fat out,
right?
The
tube that I use, the small cannula, which is 2 or 3 millimeters, it's tiny, right? That cannula has a cannula within a cannula. It doesn't have to be complicated, but there's a water jet and a suction of the fat at the same time. It's enough to loosen the fat, but it's not so much that it's going to hurt the blood vessels and the nerves and the other tissues and cause collateral damage. That's what gives you the recovery. So what do we see? We see patients don't have bruising and swelling right away. We see that the patients don't take pain medicine for very long. So you might say to me, how long do they take pain medicine? Because that's a good indicator.
Yeah.
So I studied that over 4 years, and I can tell you that patients who have this procedure take pain medicine, 82% take pain medicine for 2 days or less. 2 days or less, that's it. And half the patients don't take any pain medicine at all.
Interesting.
If you told me this, I wouldn't believe it.
And we had a discussion on the telephone. You said, look, everybody agrees that liposuction works. That means everybody agrees with that. But it's the surgical part. It's the downtime that nobody wants to go through, or most people don't want to go. And you say this solves that? I don't want to put words in your mouth, but this kind of solves that, that fear?
Right. So
Yes.
when we talk about downtime, if you talk to a surgeon about recovery, that's an unknown concept. Downtime recovery to a patient means, how long am I going to be out of work? When can I not take care of the kids? When can I not go do my job? Do I have to have my spouse stay home? So if someone's going to do something that they want to do, it's got to be something that has a controllable recovery period so they know, okay, in 2 days, in 3 days, I'd say probably 70 to 80%, if not 90% of the patients drive themselves in the next day. I never saw that before, ever.
You say it's the happiest group of patients. You know, we had a discussion in the green room that lipo, next to, facelifts, breast augmentation, tummy tucks, but the lipo is the one that makes people the happiest when it's all done. And you said you were surprised about that. Is that true?
I am surprised that is the happiest group of patients. But as my practice has evolved to doing more and more body contouring work and more liposuction, I am amazed at how patients with even a small amount of fat removed are really so much happier.
And you say it changes people's lives for some people.
You know what? I think that until I really listen to somebody and I really understand what's bothering them, there could be a small amount of tummy fat that bothers somebody, or the love handles, or the thighs. That could be so overwhelming for that person. I don't understand the magnitude of that frustration until I really listen to her or to a guy. And so once I see, okay, this is what I can do to help you. And the way I do it is it's really important to understand what is it that's creating that frustration. I ask patients, I said, look, take me where you want to go. Now, for years, I would listen to patients and they'd say like, okay, what do I need to do? Which procedure do I need? I don't do that anymore. I said, okay, so you're telling me that you've got this fatty tissue in your tummy and when you sit down, it sort of hangs over your belt. One woman said to me, B-O-B. I said, Bob? She said, no, belly over belt. And I was like, oh, okay. And she said, you've never heard of that? So clearly, like, I'm looking at somebody in this artificial way. I want to know, okay, what's the problem? But more importantly, I want to know, where do you want to be?
Now, what do they say? Where do they want to be?
And they say,
want to be at the beach? What do they want?
No, they say, I want to wear a bathing suit. I want to fit into that dress. I'll tell you a funny story. It's a lot of humility, I guess. I don't know. I had a woman come in. This was not that long ago, and she said to me, I got to tell you, this was the next day, and she said, I fit into my jeans. I was like, what? She said, yeah, I put my jeans on last night. And I said, well, you were supposed to be all, in the recovery mode. She said, recovery mode? She said, I did this so I could fit into those jeans. And she said, I love you. I can fit into the jeans. And I'm thinking about recovery mode, and it was like a knock on the side of my head. What am I thinking? What I need to do is make sure that I'm getting that person where they want to be.
Good.
Now, the artistry in it is understanding what's the anatomy, what's good.
Is there really that much art to it?
There's a lot of art to it. And, lots of people profess to do liposuction. You hear things like liposculpture and stuff, but it's really sculpting. And when I sculpt, it's the same principles. I'm looking to see what are the good curves and what are not the good curves. What's throwing the body off? And so if I can see that, and I can, then I can help somebody see where they're going to be, and I connect that with where they want to be, and that's what makes them happy.
I had my midsection done first, which I had a little pooch that all women get, and I just couldn't get rid of it. I don't care how many sit-ups I did, it was just not going away.
Over the past year or so, I have lost about 60 pounds. And what I was left with was some areas on my body that I still was unhappy with. I came in about 2 months ago, and I actually had the water liposuction on my neck and chin areas, as well as the tops of both my arms.
I now am pretty well shaped. I've gone from a size 8'10" to a size 4'6", and couldn't be happier. I'm in a two-piece bathing suit. I wear clothes that I haven't worn in years, and they fit. They're not too tight, they're not too baggy.
I came back the next day. I had already lost inches on my arms and my face. I mean, less than 24 hours later, I was taking before and after pictures while I had my garments off. So
I just wanted to change my body back to what I looked like in my 20s and 30s. And it has totally been a huge success for me.
I would just highly recommend it for anybody who has been thinking about it. At least go and talk to Dr. Didesheim and see, if it's something you're willing to do.
Let's go to your before and after photos.
Okay.
Pretty impressive. For people just tuning in, we're talking about Aqua Shape liposuction. Dr. Didesheim says you're literally washing the fat away. You go in with a traditional cannula, the water shoots in, and then the cannula, there must be some sort of a suction device that's pulling the fat out, and it's low downtime. They could drive home. So let's take a look at some of the results.
Take a look at this woman, Randy. She has, if you look at her before picture, she's in great shape. She's young. She's like 5'6", 120. I mean, she's a marathon runner. She's in great shape. You think, so what is she doing in my office? Okay, but if you look at her tummy, she's got the round tummy. She's had children. She's got a little tummy pooch, very normal. She said, you know what? As great a shape I'm in, I don't have the confidence. I won't wear a bikini. And I'm like, you're kidding me. She said, no, I won't. And she said, this bothers me. And she points to her tummy. And I said, what do you want? And she said, I want that to be flat. Okay. So under local anesthesia, with no drugs, right? Just numbing the area. She has that done. She drives herself in. She drives herself home. You look at her after picture, right?
It's flat.
It's flat. Look at the front view. And you can see, now that is a beautiful athlete. Now she feels beautiful. She is really an athlete. She was an athlete before she came to me.
How long does it take you to do something like this?
That procedure took an hour.
So 1 hour of something that has been bothering her for a while.
Now, here's the difference with AquaShape. In 1 hour, where you can drive in and drive home, she took no pain medicine. She had a result that was immediate. She looked just like that the next day. I don't know of another procedure, and there's lots of different ways to get rid of the fat. I don't know of any other procedure that can do that.
So you're convinced this Aqua Shape lipo is the best approach to liposuction?
For me,
In your opinion?
in my opinion, it's the best.
Okay,
Now,
good.
I will say that not every patient is a 120-pound marathon runner, right? And we'll look
Can
at
you
some,
do the larger patient?
Of course you can, right?
Okay.
You can do the larger patients. We do them under different types of anesthesia, a little bit of anesthesia, more anesthesia, what makes the person comfortable. But this is an example that I've repeated over and over again in hundreds of patients where there is a defined amount of fatty tissue in someone who's in great shape. There are so many women who are out there thinking, well, I'm in good shape, I don't need liposuction. Like we wrote in that article, I exercise so I don't need liposuction. But you know what? Everyone's got a little bit of fatty tissue, a little tummy, a little love handle. What would make the difference? Okay, so you're wearing that dress that really is form-fitting, and you don't want it to bulge in the lower tummy below the belly button. Or you're a guy and you're wearing something that's like, wow, okay, so you're in good shape, but now you have a six-pack. So it's just, will it make you feel better not to have that?
So if you're bothered by this this fat, this genetic fat, whether it's a saddlebag, whatever, do something about it.
Yeah, if you're bothered by this, if you're bothered by it, and you feel like, gosh, do I have to have that? No, you don't have to have that.
Okay.
Okay. Now, let me show you, can I show you another example?
Sure.
Okay, so here's a woman. She comes to me and says, you know what? I just want more shape. My lower tummy, I'm frustrated. I won't wear certain clothes. My thighs, I want to be sexier. And I said, okay. And I show her. I said, look, here are the curves. Here's what I see. This is what I think we can do. And when you look at her after picture, you see, wow, that's confidence. That's the confidence that she didn't have, that she was hoping to get. So when you look at her after picture, you see, wow, she's got a great shape. All the things I promised her are there. She's got a different body from the front and the back. You can see it. Now, what's even better than a great after and a patient that's happy, is a patient that 4 months later sends me a picture on her trip to the Caribbean.
Okay.
She sent me that picture. It came in my email. I said, I'm having a great time. I feel so sexy. It's like, wow, what could be better? I didn't prompt her to send it.
Okay.
And you can see in her smile, in her expression, she's like, yes, that's where I want to be. So the question really is, can you help me get where I want to be? And sometimes I have to say, no, I can't. But with this procedure, what I can do that's different is, yeah, I can do this with less recovery than I was doing before. And I know that patients don't take the pain medicine they took before. Therefore, they get back to their life quicker. They go back to work quicker. It's better.
Because people talk to me, I have friends or they email me like, what's the hot new procedure? And I said, well, according to this one plastic surgeon, he says Aquashape Lipo is the next big thing. And it works.
So look, here's the reality. If you have, everyone's got some stubborn fat. We know that, okay? Something that you want to just get rid of, that's fine. You know, for most plastic surgeons, they do liposuction. It's not what they like doing. They want to
That's true. They come on my show, they go, Randy, I don't want to be
Yeah.
stuck doing lipo all day. You like it though.
Right. I like it because I can use the finesse and the artistry and the sculpting and combine that with understanding the technology that, okay, I've got something that's safe, it's predictable. You know what it all comes down to? When I tell patients, they want a predictable result and a predictable recovery.
Okay.
Surgeons are trained to get predictable results, and the recovery is their problem. But that's not what my patients ask me. They want predictable recovery. If it's too big, they won't do it. They're scared. Why are patients scared of all kinds of big surgeries? Because they're scared of the recovery. So I said, okay, I'm going to find out a better way to do what I do. And I can tell you that this is a better way. Why don't all surgeons do it this way? Because for a lot of surgeons, they have a way to remove fat. They think, and maybe this is the difference, is that, okay, if you have extra fat and I'm sucking it out, then everybody's happy. And the more I suck out, the better. And I know some surgeons that they market themselves or they pride themselves on how much they can take out. I don't want to do that. I want to do what helps the person, that woman or that man, get to where they want to be. And I want to do that in their time frame.
Now, I don't want to interrupt you, but I know you want to show a bunch of photos and we're short on time. So what else do you have?
Okay.
What other?
So this is a woman who came in. You can see from her pictures here before that she had large thighs. It was a real problem. She couldn't wear pants. They were always too big in the waist. She was frustrated. It wasn't going away. You look at her after picture, you can see both in the front and the back, her shape looks great. It's normal. And that's what she wanted to be. Now she can wear anything. You know, this is not just for women. So let me show you what we do for men.
Okay.
So here's a guy. He's young. He's going to the gym. But you know what? He's got fullness in his chest. He's got sort of a pudgy tummy. And, you know, he wants to look great. And Randy, when I look at him, I can see, okay, I'm going to take a little bit off his chest here, a little bit in his love hand, a little bit in his tummy. It's a sculpting. And I can see what he's going to look like. He's going to look great. He's going to look like he wants to look. Look at the after. And what do you see? He's got a six-pack.
Yeah, he looks in shape.
Not every guy's going to have a six-pack.
Right.
But his skin is tight. He's youthful. He's young. He's got great muscles. You see it. So that's what I imagine he would look like. And you can see he's got no love handles. He's got great definition. He looks buff. That's what all guys want to look like that. Don't you want to look like that?
Yeah, it looks good.
Right? So it really made a difference. But it's not how much you take out. It's not that everyone should do it. It's the artistry of being able to see, okay, I know what you need to get where you want to go. Now, if you can do that with a short recovery, yeah, that's like great.
Do you think that, because look, people that are watching this, most people agree, like we said before, that if you're over 30, if you're over 40, for sure, you have a couple of inches you could pinch, right? Mm-hmm. And most of these people would love to get lipo or get rid of that fat, but the downtime. So do you think that the people realized how good this could be as far as low downtime, they could drive themselves home, that they would do it? I mean, are there that many people that don't like the fat on their abdomen where you are?
Yeah, there are. Look, I'm in North Carolina. We have a lot of people that don't like the fat on their tummy, but that's true of all over the country.
Yeah.
But Yeah, I think there are a lot of people. If you ask most people, would you take care of that? The first question they're going to ask you is, well, what's my recovery? So if you have a quick recovery, but you don't get the result, or you don't get the result for a couple of months, or the result is very minimal, it's not what you want. You want to go from where you are to where you want to be. Now, you're asking me, can you do that predictably? The answer is yeah, you can.
Okay, good. What areas of the body do you do?
So,
starting from the top, going down.
Okay, for men and women, neck, tummy, back. For women, the bra roll. That's an area women hate because the bra presses, there's fullness on the top and the bottom.
Is that a common area?
Very common, very, very common. And you can see in some of these results, you know, that is nice and smooth on the back. The hips, the thighs, the inner thighs, knees.
What about arms?
Arms. Arms are great. You know, for you and me, we're wearing shirts, it's okay. You wear a jacket, it's okay. What if you're wearing a sleeveless top and you're a woman?
Yeah.
Right? What if you want to wear a certain top? You can't do it. So here's a woman who came to me and said, okay, I hate my arms. I'm not wearing certain clothes because of my arms. Okay. I said, here's a procedure where we can do a procedure called circumferential arm shaping. And what that means is that with this technique, I can do the liposuction differently than I did it before. It's different. The cannulas, the tubes I'm using to do the job are smaller, they're more delicate, so I can get the skin. You'll see on that line in this picture, you can see that from before to after, her skin has contracted. You'd think, oh, you need laser. You don't need laser. So it is how it's done, but more important than anything else is she had a quick recovery. She's great. And you know what? So I should have done this years ago. More patients come in and say, I should have done this years ago.
We literally are out of time.
Randy, let me show you a few quick...
2 minutes, 2 minutes.
Let me show you some results here. So Randy, here's a woman that came to me. She had 2 children. She said, I don't want a tummy tuck. What can you do for me? And you see her result. Her tummy is so different. She's in a bathing suit. She's happy. That's where she wanted to be. Here's a guy, great shape, but now he's got his sculpted abs, right? Here's a guy, man boobs, right?
Oh, boy.
Right? Totally limiting. You see before, after, he's great. Here's a woman who is short, right? She just had this full figure. Okay, afterwards, she's got shape, and she's ecstatic. So here's another patient. You can see in her before, she's frustrated with her tummy. She doesn't have the shape. After, she's got a nice, shapely, athletic abdomen. What I want to show you is what I do with the fat instead of just throwing it away. Because now, in the 21st century, I have the ability to take this fat and do some really cool things with this. And this is probably the hottest topic in plastic surgery right now. If you look at this woman, right? She's in her late 50s. She came and she said, you know what? I'm looking old. What can you do? And I don't want a facelift. Now, facelift's a good operation, but she said, I don't want a facelift. I took the fat and I used it to restore her face. And her grandkids said, Grandma, you look younger. I mean, they're not going to lie. And that was great. So look at her eyes in the before, how tired she looked. Mm-hmm. And then look at her in the after. And you see
very nice.
She had a little bit of skin taken out of the upper lids, but what really gives her that youthful look without doing anything else is that she has these youthful eyes from the fat grafting. Let me show you one other patient. So here's a woman who came to me and she said, I'm 63, I know I look older, I don't want to wear makeup, I just want to go, and I will not have a facelift. Okay. Now, a facelift's a great operation, but she said, I will not have a facelift. And many women come in and say that. So this is a picture that you can see what happens when you take the fat and use it to restore shape in the face. And when you look at her after picture, she looks better. She looks more youthful, but she looks like herself. The greatest fear is that she's going to look different. She doesn't look different. So if you look at her pictures, look around her eyes. She looks tired, like the other one. She looks tired around her eyes. She's showing the age around her eyes. And I'll tell you, this is one of the most exciting things that I'm doing. And if you look at her after picture around her eyes, she looks rested.
Yep.
She looks better. When people come in and they're scared, they say, I don't want to look different, I want to look rested. When I look at these patients who I've treated, they look rested and they're happy. And they can see that they just look better. Now, look at her mouth. That's even more. Look at her mouth. And if you look at her before, She's got these lines around her lips. Every woman's got that, and they're just so frustrated. She just looks old on her mouth. Okay. After I was using the fat to graft back, to put back in what she lost, you can see that she goes from an old-looking mouth to a more youthful mouth. And you really see when we look at the pictures side by side.
Now, we are really out of time this time. I want to thank you for coming on the show. So the thing to ask your surgeon is, do you do aqua-shape liposuction?
Aqua-shape liposuction.
And many of your patients, just so we're clear on this, because you say most people would get lipo, but the downtime is too big. You're saying they can drive themselves to your place.
Right.
And have their abs, maybe their love handles, and they drive themselves home. You only numb the area. Is that correct?
So what I'm saying is this. So it is very reasonable to think you have a small area that you can do. You can come in, drive yourself in, have the procedure, 1 hour, drive yourself home. Now, if you're going to have more areas done or more needs to be done to get you the result, then we're going to use anesthesia. And I do all the operating in a accredited operating room that's certified. We have all the anesthesia capabilities. But it's what's going to be best for you to get you predictable result so you can be where you want to be and have a predictable recovery. Even with the bigger procedures, the recovery is still less than anything I've ever seen.
So I want to clarify something. You said in 1 hour. It takes you 1 hour, but they're there more than 1 hour.
So if
at your office.
So let me tell you, that's a great question. So if you drive in, it takes 15 minutes to get you ready. The procedure is 1 hour, 15 minutes, so an hour and a half door to door for someone with a small area like we looked at.
So you could flatten out a stomach, and they're back to work, maybe even that day if they had to.
Absolutely.
Is that true?
I have patients. That's true. I have a woman who had this done, and she went shopping for the rest of the day. I was like, "You're kidding me." So So
this is the next generation of lipo.
This is
aqua-shaped lipo.
Look, for me, it's better than anything I've ever used. And after doing it for 4.5 years in 300 patients, I can tell you that if there was something better, I would have switched and done something else. But this gets results and gets predictable recovery like nothing I've ever seen.
All right, I want to thank you for coming to the show. Great stuff.
Thanks a lot.
Great stuff. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.